let's talk about the disc herniation that you have on your MRI and why it could very likely not be the cause of your pain. My name is Shelby. I'm a doctor of physical therapy, and I just wanted to talk a little bit about why the disc changes that you found on your MRI are very, very normal findings to have. And this is an important conversation to have because most adults have some type of back pain. You know, they've at least experienced it once over the course of their entire life. And it can be scary too. There's a lot of fear that we've trained our brains to centralize around like low back symptoms. Some of the most important things that I educate my patients on when they come to me with low back pain or MRI images that show disc changes on them, whether that be degenerative disc disease, arthritis, disc bulges, or disc herniations or protrusions. So what we are finding with research, one of the most widely cited systematic reviews, and I come with notes because I want to make sure my information is accurate. I want to make sure the numbers I'm providing is accurate. There's a lot of misinformation in general about like health and wellness out there on the internet, and my goal is to provide information to kind of combat that misinformation. But anyways, the systematic review was published in the American Journal of Neuroradiology, and it looked at over 3,000 people with no back pain, no history of back pain, recurrent or significant, right, back pain, and found lots of interesting things. So in their subgroup of 20-year-olds, they found that 37% of those individuals without pain had disc degeneration on imaging, 30% had disc bulges, and 30% had disc herniations. Yes, whole ass herniations with no pain. And then in that study, we found that most of those statistics increase with every decade of life. So if we go further down the line and look at our 50-year-old cohort, 80% had degenerative disc disease, 60% had disc bulges, and 36% of those non-painful individuals had herniations or protrusions on imaging. So what does this information tell us? It tells us that these findings are common. They're a normal condition of an aging spine. It's a load-bearing joint, so that's something I tell my patients often also. Anything that is bearing load is just going to naturally show changes as we age, and it doesn't always cause pain. So if we have back pain and we have those changes on our MRI, but we don't think that those changes are causing the pain, what would be causing the pain then, right? Like that's kind of where your brain would naturally go. And the truth is that pain is just multifactorial, and it's way more complex than just our tissues. So what we're finding in our research on pain and how our nervous system and our brain is present in our pain experience, we call that pain neuroscience. There's a lot that could be going on, not having to do with your discs in particular, that could be contributing to your pain experience or causing pain. So that could be anything from nervous system sensitivity, your sleep habits, because your sleep habits heavily impact your nervous system regulation, right? Our recovery habits, our movement habits, our activity dosing, like is our body conditioned for the activities that we're doing every day? Our body mechanics, do we have like a muscle that could be weak, or maybe something's tight, or maybe, you know, the joint capsule is implicated in your pain. We have other tissues in the back that can be pain generators just as likely as discs can. We have ligaments back there, we have tendons, we have nerves, again, we have muscles, we have joints and joint capsules. So that is why two people can have very similar images on an MRI, similar findings, but have two completely different experiences. We can have someone who is in a lot of chronic pain, it's impacting their ability to function from day to day, and then we can have the other person with the exact same image who is just living their life without any pain at all.